All right, guys, I wanted to share two studies with you guys. Hope you guys get something out of this. And so the first study was done just, I guess, published yesterday, and it looks at something called the waist to calf circumference ratio, which is an interesting metric. So basically, they looked at, this study was done out of China, looked at several thousand people, and they looked at the progression to dementia or cognitive decline. And this is something they use something called a mini mental status exam, which is just a series of questions. How old are you? When's your birthday? Who's the president? You know, draw a clock face, do some simple addition and subtraction, count numbers forwards and backwards. And these are studies, these are things that like they're proposing, hey, maybe the president should have to take to prove his mental fitness. But they looked at people that were in their 80s, I think the average age was 81, and they looked at the progression to dementia. And they compared that to what their waist size, what their calf size was, and then what the ratio between the waist and calf size was. And what they found was, not surprising, the people with the biggest bellies had the most dementia. The people with the skinniest calves had the most dementia, and particularly the people that had the biggest belly, smallest calf ratio, were the worst. And so what this means is that this is a proxy for lean mass versus fat mass, strength versus non-strength. Calf muscle is a proxy for muscularity. Doesn't mean by going out and doing a bunch of calf raises, you're gonna prevent dementia. It's just how you overall have with your body, being lean versus obese. And we see that with strength studies, and you see with grip strength studies with people living longer if they've got there was, I think, Honolulu longevity study where they looked at grip strength. The people that had the strongest grip strength in midlife had a 250% increased likelihood of reaching it to 100 years of age versus people that had lesser grip strength. Again, it doesn't mean going out there and doing grippers is going to make you live longer. But again, it's just overall having more lean mass and less fat mass. And particularly lean mass, having a lot of lean mass is very helpful. Now, it doesn't mean huge bodybuilder, but it's just relative to the average person. You want to be on the stronger side, right? So that's an important thing to do. Another study, this is the Inchiani study that was done earlier this year in Italy, in Tuscany, Italy, and they looked at, again, several thousand people. They tracked them for 20 years or so, and they saw how many people died, and they compared that to what their animal protein consumption was like. The people that ate more animal protein, surprise, surprise, lived the longest, had less cardiovascular disease. This again goes in contrast to what you may have heard, but this is, really what some of the data suggest. Again, this is all observational stuff, so you have to take it with a grain of salt. But again, there's these relationships, and I would maintain that whatever you do to increase and maintain your lean muscle mass is going to help you have a better quality of life and probably a longer life. And we also know that animal protein is superior to plant protein in just about every way with regard to completeness of amino acids, bioavailability, and overall ability to maintain muscle. That's just clear. All right, guys, hopefully it's helped, and we'll talk to you soon. Bye-bye.